So this all started back in 1982 with Monsignor Puma completing his mission, which he felt that the Holy Spirit gave him this mission to serve the Spanish poor. So we're sitting in the Sister Kathy Center. We used to have our board meetings in here, and it was very interesting. This building is named after Sister Kathy Rowe, who was a sister of charity and a very dear friend of Monsignor's. And just because you were a dear friend of Monsignor's doesn't mean that he didn't argue with you or disagree with you at all times, but Sister Kathy was one of the very special people in the life of Eva's and in Monsignor's life. He was the pastor at St. Vincent's in Madison, and when he left St. Vincent's, he spent almost 3 years alone living in the basement of Newman Prep. He went for his MSW and different credentials, became a counselor, and finally got the convent over at St. John's Cathedral, where he started with a group of people making food and feeding the poor.
It was in the basement of the convent, but the convent had 3 or 4 floors. So once Monsignor realized that the major issues that many of these homeless folks had was either substance abuse to either drugs or alcohol, he promised them you could stay sober for 2 weeks. You could have a bed in the dormitory on the first floor. And then as they progressed, he had AA meetings, NA meetings, and as they progressed in their sobriety, they could move to the 2nd floor and then ultimately the 3rd floor. If you stayed with the program, you eventually got a room up on the 4th floor. You could lock the door. Monsignor helped you to start a bank account, get your papers together, and help folks get a job. I think they used to call it St. John's Three-Quarter House.
And Monsignor found out that 33% of the people that he was feeding in the convent had tuberculosis. So Monsignor Puma went ahead and got a trailer, got an X-ray machine, and had all the people that were being fed go through the X-ray machine, found out then 33% had TB, and before he would feed them, they have to take their meds. Now, he got the X-ray machine, the trailer, the meds, all with no approvals, permission, types of ordinances that he decided to make his own up, and he just went ahead and did what he had to do.
He kept adding programs. Wherever he saw a need, he was able to figure out some way to address it. He didn't always ask permission to do what he did, but I think he always felt that it was easier to ask forgiveness than permission. So if he saw a need, he started something, and if people said, well, you know, he had it up and running before they even knew it.
If you think about Eva's Village today versus where we were 40 years ago, how have we evolved? How have we changed over the last 40 years? I think the most obvious indicator of that is the number of people we serve and the number of programs we have.
There are so many roads to recovery. We have quite a few clients who are prescribed MAT, which is medication assisted treatment. But there's also a new word called MOUD. It's MOUD, and that's medication for opioid use disorder. So they're playing with the word with that. But yeah, it's very successful. It's very good.
If you think about our substance use disorder programs, our addiction programs, we have so many different levels of services, of programs available to people today that we didn't have before. We have a recovery community center, which is a community-based support group type of situation. Think AA meetings, Narcotics Anonymous. And that works really well for some people who want to have communication and work with people who have had those experiences before. But for some people, they need a little more help. So that's where we have our outpatient substance use disorder programs. And we have 2 levels of intensity there. Those are clinically based, you're dealing with counselors, and in some instances, they offer medically assisted treatment, so medication to help overcome your addictions. And then there's another level of substance use disorder programs, and that is our halfway houses. We have a halfway house for men, a halfway house for women, and a halfway house for women with children. And that's a really unique program because it allows women who are going through recovery to live with and care for their children while they're on their path to recovery. But the halfway houses offer a regimented, structured residential program for those people who need that level. So again, if you think about Eva's Village as a whole, the number of programs we have now and the number of people we're touching has changed dramatically over the last 40 years.
Got some new stuff happening at Eva's, some new partnerships, new programs. We're growing the organization, we're restructuring, we're putting in a foundation that's going to be transformative at Eva's. The culinary school, it's been open for many years, but we had to suspend it during the pandemic. We want to reopen it, and we're reimagining how we're going to do it, how we're going to provide those services. We want to improve upon it.
We are privileged to be able to have this program here where we can train folks in the field of culinary arts and get them a trade and in a profession that they can use their skills and find them a job.
They had the culinary school, which I did. That was 6 months of being there in transitional housing. And after I finished the culinary school and graduated, I did my IOP with Robbie Felice at Viaggio and Wayne. And then I got a job with him, and I've been working with him ever since. I was just in the Mommy and Me in the outpatient, and the chefs came in, Danielle came in, and she was like, we have this culinary school and you guys can come to it and it's absolutely free, and we got you childcare and we just want you to come and see if you like it. So I went and I really, really liked it because it was something I was sort of familiar with. So I tried and I kept trying and I learned and I did really, really well. I graduated top of the class.
We're trying to hire people that have an education, and Eva's Village gives them a culinary education, and actually in a pretty quick turnover where they can be working pretty quickly. So it works out for us that when we hire somebody, they understand how to make sauces, how to use knife skills. They know the basics, and then they hit the ground running.
For us, the culinary school has been an educational facility. Now, we'll not only educate people, we'll provide food to local partners. For example, the church across the street from us, St. John's, we're providing kids with meals, 40 meals a day, 5 days a week. Beautiful partnership. It's a great benefit, and it's coming from our hands that have prepared it. Our culinary school will grow to provide services to not only St. John's, but other local partners as well.
There's such need in Patterson. More than 30% of our residents are living in poverty, and over and over and over again we hear from our clients the number one reason why they can't focus on a job or their futures is because they don't have anywhere safe to live.
BEC is an initiative which stands for Building Healthy, Equitable Communities, which is a group of 11 Patterson nonprofits who have come together to try and improve the social determinants of health through built environment projects.
BEC promises to be an opportunity to serve our community in ways that we haven't imagined. We were invited to join this partnership. Other nonprofits in Patterson had already started this a couple of years ago. They said, hey, we've got this thing, we're challenged, and Eva's had an opportunity to contribute to solve that part of the problem, and so we're there. That initiative is to create childcare and housing, more affordable housing and quality childcare in the city of Patterson, and we had the property to do it.
Eva's is, housing expert, right? They do this, but they've also been serving the homeless and the addicted. They know what Eva's knows what the people in Patterson need to be able to rise above their current circumstances.
About a year ago, we really focused in on a specific subpopulation of single moms and really began to dive deep into what are the needs that single moms face and how can we help change their outcomes. And we've incubated a project with Eva's Village, Oasis, and others to create a supportive housing model that is integrated with a child care center.
Monsignor had a great vision and we're just building on it. So Eva's of yesterday, it was Eva's that was solving the issues that people brought when they walked in the door. Monsignor ran a very tight ship. Today, Eva's has a responsibility to deliver services that meet regulatory requirements, but at the same time continues to provide the level of care and concern that we've done in the past. We've just got to do it better and do it differently. It also means that we're data-driven. We want to understand who we're helping and how we're helping them and what are the outcomes. And we need to go back and tell our funders, this is the community that we're serving and the impact that we're having. So it's deeper, longer lasting, more impact, and a better use of every donor's dollar. We want our donors to know EVAS is here, but the best thing we can do is solve the crisis so we can put ourselves out of business. That needs to be our #1 priority.